Good evening and welcome to this week's Beyond the Front Page program for the spring 2018 semester here at Cayuga Community College and broadcast on Spectrum, Verizon, Fios, the Auburn Regional Media Access, better known as ARMA, as well as Win 89.1, the college's radio station. I'm your host, Guy Cosentino. If you grew up in the 1970s, there seemed to be two types of public health advertisements that ran in the region, especially on New York's WXII as well as WPIX. One was the danger of construction blasting caps, and the other was the dangers of lead paint. While blasting caps may not still be a big issue, lead paint poisoning is still a major health issue. About 2 years ago, the Cayuga County Health Department put together a task force to look at the issue of lead poisoning locally. There was a concern of elevated levels in the blood work of adults and especially children. Of greater concern has been the number of children with lead poisoning that could be connected to rental properties as well as lower economic means for those families. We've invited Cayuga County Health Educator DEANNA HOEY on to talk about the county's efforts to combat lead poisoning and other public health efforts. Welcome back.
Thank you for having me.
It's been a while.
It has.
In doing all this, I want to talk to you a little bit about just the overall arching. How did this come back on the radar screen? Not that it ever left, but it really hit home for the health department about 2.5 years ago.
Yeah, so about 2.5 years ago, there was a child who was tested and was significantly poisoned. And we've always had a lead poisoning prevention grant. We've always encouraged testing of kids at 1 and 2 years of age, which is public health law. And we have monitoring and case management that goes on at the health department. And with this particular case, the child got tested at 2.5 years old. And through our investigation, we noticed that the housing unit she was living in was a rental and it was in pretty bad condition. So right away, we knew that the housing environment poisoned her. Our administration reports to our local Board of Health, and so they brought this case to the Board of Health, and the Board of Health said, we have to do more. And so from that was born the lead task force. We made presentations to the city council because this rental unit happened to be within the city of Auburn, and we've been meeting monthly ever since.
So just on that, I'm going to skip all over the place, and I apologize for this. So it looks like you've had 30 cases in the last 2.5 years, roughly.
Yeah.
Of elevated
leads, yeah.
Lead. And of those children, 22 were in the city, and of that, 16 were in rental units. Mm-hmm. What does that tell you? From a county perspective, what does that tell you about the issue?
So a good majority of the people reside in the city of Auburn, so of course we expect that more cases would be in the city. What's alarming is the number of children residing in rental units that are poisoned. And so that relates back to the quality and the condition of the homes that they're living in. So unfortunately, lower income families are finding properties that aren't so great to live in, but that's all they can afford or that's all they can get into. And that's what's happening.
And part of it is that most of so lead paint in 1978 was banned from use, correct?
Yes.
But most of the properties in the city of Auburn were built prior to 1975.
Yeah, so code enforcement gave us a stat from the city that said about 95% of the housing is built before 1978. So with that statistic, 95% of the kids living in the city of Auburn, we think are at risk because there's so much older housing stock that there's likelihood that there's lead paint somewhere. So
how do you get rid of lead paint to start with? I'm going to ask you some remedial questions on just. So I'm assuming, and again, I'm going back to these as a kid, I remember these ads and they would show the child gnawing on the windowsill because they're looking out for mom or dad or whatever's outside. I'm assuming, okay, let me just step back a piece. How do children or adults contract lead poisoning?
So lead paint isn't a problem if it's intact. It's only a problem if it's peeling, chipping, flaking, or turns into dust. So children can be poisoned most often from lead dust that's on their hands and from simple hand and mouth gestures like eating, playing with their toys and whatnot. Some children have ingested paint chips, and what we've been told is that lead paint tastes sweet. So once a child gets a paint chip in their mouth, of course they want more. There's been some cases where children have actually eaten the baseboards around a room.
Because they're gnawing at it because they're teething or whatever?
Yes.
Okay. So when a child is discovered having been poisoned, you all you get the information from a hospital or a health provider that there's a lead in their bloodstream,
Yes.
correct?
So any test that's performed, we get through a state database. So whether it's performed in a hospital, healthcare setting, or a doctor's office, or even our test that we perform at the health department, it gets entered in, and then we get daily reports. And our intervention levels start as low as a level of 5. 5 is basic education to the family, homeowner, about what they can do.
Can you ban somebody from going back into their place?
So yes, we have done that if a child is chelated, and that's a medical.
I'm sorry, what's that mean?
So it's a medical treatment that is administered in a hospital. And so if a child's lead level exceeds, I think it's like 45 micrograms per deciliter, that would warrant them going into a hospital for 5 to 7 days and having this treatment where lead is excreted through the kidneys. It's pretty painful and pretty costly. At that point, they're not allowed to be discharged from the hospital unless they are returned to a lead-safe environment. And most oftentimes, they're not going back to the home because the work is too extensive for them to go back to.
So I had a friend maybe a decade ago who moved into a rental property, moved back to this community, moved temporarily before they were buying a house into a rental property. His children all had elevated. They literally left that apartment and did not go back. I think that was voluntary, but can you ban somebody from an apartment from going back? And how do you deal with the economic issues for them?
Yes, those are all things we're kind of exploring at this point in relationships to this child and other children. Sometimes they get DSS subsidies, and so that's where we would be looking to not have a policy in place where we wouldn't issue a DSS subsidy on a unit that doesn't have a valid certificate of occupancy from the city. And that's all work that's being done through the lead task force. Really we work with the family and the landlord through our environmental inspectors. They go out, they find the hazards, and they issue notices of demand and require the work be done either by a certified lead contractor, or if the work is small enough, usually the landlord or the homeowner can do that work.
So when the city goes out right now and inspects something for occupancy, do they test for lead?
They don't.
Okay.
They cite for peeling, chipping, flaking paint, but their staff are not lead risk assessors, so they don't have a machine to do that testing.
But if they see something where there is chipping and peeling, will they still issue a certificate of occupancy?
I think it depends on how much peeling and chipping, flaking paint.
Okay.
They cite it, but I think there's a lot of other factors that play into when a certificate can be issued or not.
So when a child, so let's take this 2.5-year-old, and I don't mean to make them the center of this, but when they're identified as having lead poisoning, what does that do to their system?
So lead poisoning at low levels, not even the level that this child was at, it really harms their development, their ability to grow and learn, and their behavior. So they could be hyperactive, show signs of ADHD.
They could all be linked to lead.
Yeah, their health outcomes are greatly impacted by a low-level lead poisoning. This child had 2 rounds of chelation treatment. So,
and what is that? What's the problem?
So it's like an IV therapy that's administered only at Upstate Hospital. It's 5 to 7 days of treatment to get
You're an inpatient.
You're inpatient, yep. And so, it's stressful on the family. Now their child's been poisoned. Now they have to find new housing. It's a lot for the family to kind of deal with. And it's something that can be prevented. Paint doesn't cost that much money. You can wet scrape and wet sand, and then fix those peeling, chipping, flaking spots with a simple can of $20 paint.
So once a child has been identified as having lead poisoning, can the impact be reversed?
No, once the child's poisoned, the damage is done, it's irreversible, which is the saddest thing you could ever imagine.
So is this what's the treatment? What's the purpose for the treatment then?
So the purpose of the treatment is to get the levels down in the blood so that they start coming down and that they don't spike and continue to cause more damage. What we do at the health department is we case monitor them all the way until they're back down to a level that's below 5. So that level of 5 is the threshold where we get involved, and that level of 5 is where we want them to come down. There's kids that are 9, 10 years old that have been with our agency since they were 2 years old, and their levels are just not coming down. Regardless of, we go out, we do routine inspections, and their house looks like it's intact, and sometimes lead is just stored in the bones, and it's really hard to get out.
And is there data that the county has looked at? Again, I mentioned these things in the 1970s. Has lead poisoning overall gone down? Not that we've had a lot of new construction in Cayuga County, but are the numbers lower than those rates, let's say, 2 or 3 decades ago?
I'm not really sure that monitoring was as intensive as it is these days. The threshold levels have all been changed. So I know that in the past couple of years, the higher levels of lead poisoning have decreased, but we're also starting to monitor at a lower level. So we have, more kids at between the 5 to 9 range than we've ever kept track of. And we're trying to be more proactive and work with those kids that are at a low level so they don't get to a high level.
And you have this task force. When was it formed?
I think the fall of 2015, we kind of presented to the City Council, and our first meeting was January of 2016. So we've been meeting for about 2 years.
And who sits on it?
So it's Legislator Batman, our Public Health Director Kathleen Cuddy, some Health Department staff, environmental people, nursing staff. We have City of Auburn representation and schools, and then some community-based organizations like HomeSite and Cayuga Community Health Network. Okay.
And what's the goal of the task force? Is it education, or is it elimination, or is it both?
It's both. It's raising the awareness in the community that lead paint poisoning is a problem. Flint, Michigan happened a few years ago where lead was in the water, and it was a big crisis, big deal. And lead poisoning through paint has been a problem in Cayuga County, and it's not going away because we have older housing stock. So it's education. It's trying to turn our program at the health department from being reactive into more proactive, maybe get some policies in place that improve the housing quality and the conditions that the people are living in.
So one of your legislators, I think I read one story where I think it was you, made the presentation to the county legislature. Mm-hmm. And one of the legislators said, well, can't we, not pay those people who provide housing, whether it's GSS money, mm-hmm. Department of Social Services pays for apartments for those in need. Can we just stop that? Is that a practical solution?
It's not practical right now. We need to know that the certificate of occupancies that are issued by the city mean that the house is in good condition and that there isn't lead paint or peeling paint happening in those homes. It could be a great method and a great tool to use in the future if that certificate of occupancy is actually truly meaning that the house is in good condition.
So is there a hope to either secure grants or get funding to have the city be capable? And I know we're putting this on the city. There's 23 other towns and villages here, mm-hmm. But the city's the concentration for a lot of human services, public transportation.
Mm-hmm. And it's a good, big concentration for our lead-poisoned kids. There's 16 of them residing in rental units, so it's pretty alarming to...
Were you surprised that there wasn't that, the numbers were not spread out among the rural areas as large?
Not so much. There's less rental units, and...
So you believe there is a direct correlation between a rental unit and lead poisoning?
I do. I do. In terms of the number of cases that we've had, there have been cases of a parent, renovating their house, doing the right thing, trying to make their home better, and knocking down walls and creating dust and poisoning their child inadvertently. Mm-hmm. So there are those cases where a parent has been the homeowner and has done work and poisoned their child. But I do think that we really need to look at the housing quality and the housing stock as a whole in the city of Auburn.
And that goes normally during the campaign season. That's about the outside often. You're talking about the inside as well.
Yeah.
And have you found any links that some properties, not necessarily property owners, but some properties have had multiple incidents of children at the same legal address?
Yes,
that may not be family members.
Right, there's been some cases of that where it's been a recurrence or a new occurrence of a child being poisoned in that unit. Our public health director is looking at designating some neighborhoods or a home or a street as an area of high risk, and we're exploring that as an option to have our staff go in and assess for lead poisoning and things like that.
So let me suggest that I fall below the poverty line. I have at least one child. I, for some reason, need services from the county, and I find out that I have lead in a property that I own, not necessarily that I rent. Is there any funds out there as a homeowner that I can get to help me remediate? Because now I'm supposedly paying a mortgage. How do I fix my problem without having to move?
Right. So sometimes, like I mentioned earlier, the problem is if it's peeling, chipping, flicking paint, we can encourage the homeowner to do that themselves. Other times it requires more extensive work, and there are grants that the city has, HomeSite has. So we encourage families, if we do encounter them, to seek funding from other agencies.
So whether they're a homeowner or if they're a renter, are there funds available for renters as well?
There are. I think there's a rental rehab grant that HomeSite has for landlords to apply for. And then there's other funding that is available.
Okay, so since you've mentioned HomeSite a couple times, my wife does do some work for them, and I should say that as a disclosure.
Yes.
Her agency oversees them. That was not originally planned for this discussion. When you've identified that, I want to go back to this comment as the legislator said, because in the back of my mind, the other question I had is, do we have enough lead-free properties to house people if you had to move them out of lead exposure?
So that's the catch-22 that we're in right now, is that when we have had children be poisoned and be admitted to the hospital, we've had difficulty finding them lead-safe environments. So sometimes they're temporarily housed in a hotel until our inspectors can go out and verify that that home is indeed lead-safe. So when we're looking at exploring all of our options in terms of, do we pay a landlord a DSS subsidy or other voucher type assistance programs, do we do that as the initial, or do we improve the housing stock and the quality of the housing before that? Because there will be that ebb and flow of, we've got to do one before the other.
And if I remember, I thought I read one piece of data from Jenny Haynes, the planning director. The majority of housing stock in the city is rental now. It is not owner occupied.
Yeah, it's at least 50%, if not more.
Which makes it even
more
tougher
difficult.
to deal.
Yeah, and her staff are, dealing with residential and commercial units and things like that. And Jenny's been very involved with our lead task force and trying to come up with some solutions that work for the city, the city staff, and for the county as a whole as well. So,
if you had, from your perspective, where should, as an educator, where should people be concentrating their efforts right now?
I think families really need to be diligent in getting their children tested at the recommended 1 and 2 years of age. It's important that providers, if they don't test in their office and the family's given a script, that the family makes every effort to go and get the child tested at a laboratory.
Okay, so back up the bus for a second. So I most likely did this. I'm assuming we did this. We went to Dr. Graney. He was tested. Our son was tested at 1 and 2. Don't have the numbers. But if you go to an appointment right now, are you automatically tested?
So it's supposed to be done at 1 and 2 years of age. I believe it's the well check visit.
Okay.
And if the provider doesn't test in the office, either with a finger stick or through the vein, then they'll write us.
Which is really a nightmare in itself.
I know.
Okay.
Yep. So the finger stick is a great alternative for families if their child's not compliant with getting the vein, or they're just scared to have their child go through something like that. The finger stick's a better option. And we do also offer finger stick.
So I was going to say, can someone go to where do they go to the county office building, or to WIC, or how does somebody get tested
so our
if they're
staff
not?
Meet the community wherever we need to go. So we've gone to events before. We go to the WIC clinic. People can come into our office.
And are they instant response tests in the sense that if you do a finger prick,
I think it's fairly like 3 to 5 minutes, I think.
So this happens, I'm assuming. Not everybody goes to a well visit. How big? So I'm take off your lead hat for right now, which is very heavy. You're a public health educator. How about the whole portion of the population that doesn't go to well visits? Do you see that as an issue?
I don't have a lot of data on that. I do think that engaging kids in particular in healthcare is huge. I think that they need to go and be followed and managed by a healthcare provider. We have. So
it's beyond emergency room visits.
Yeah, I think prevention is important, And that's what the well-check visits and the other establishing yourself with a primary provider is. It's to prevent you from getting ill.
So was the 2.5-year-old, when they were identified with a lead issue, was that because they went to a well visit or because they ended up in an emergency room?
So I think that they were encouraged to get testing before and didn't. And so when the provider was actually able to test, I believe it was done through a finger stick and then venous confirmation and then sent over to the hospital.
Okay.
So it was a quick process. Once the finger stick came back so high, they knew that they needed to do a venous confirmation right away.
And not that everybody's not connected to the internet, but whether you go to Seymour Library or the Wheatsport Free Library, whatever library you want to go to, you can find more about lead on the county's website, County
Yes.
Health? Okay.
Yep, it's cayugacounty.us/health. If anyone's interested in calling and having their child tested, we do that. They can call our main number at 315-253-1560, and they can get an appointment.
And do public schools do any education on this front? Because you mentioned in the task force there were some schools.
Yes.
Are they public schools?
Yes.
Okay.
So Union Springs School Superintendent became engaged with the lead poisoning because New York State required that the schools test their water systems for lead. So he became involved in that capacity. And then there's also an option for families or homeowners to test their own private water that comes into their home.
Okay, so now we're talking about two different things now. So not to get two things confused, but I'm assuming you can get lead poisoning from paint, flakes, dust, all of
Yes.
that. Can you also get it from lead pipes if your house is full of lead pipes?
Yes,
and corrosion
potentially
that way?
you can.
Okay.
So most often when we do our investigations, our children that we are finding are being poisoned by lead-based paint. The public water came into play with Flint, Michigan, and so in an effort to kind of address that, Governor Cuomo had encouraged schools be tested, and then the next round of that was that the public could test their own water at their house.
And is there a way for county involvement or city code enforcement to help people test their own water if they have lead in their water?
So they can do the sampling program that I'm talking about. They can do it free of charge. They just contact the state. It's on our website. They would contact the state, or they can contact us and we can assist them. And the sample is sent to the state, and then the results are given back to them.
So I'm assuming that if 95% of the properties in the city of Auburn were built before 1975, the vast majority of them are still using lead pipes.
I don't know that for sure.
Okay.
The paint is more my scope of work, but our environmental staff would be able to, and the city would be able to tell you what type of pipes are going into the residences.
Okay. I don't want to let you get out of here without talking about a couple of other things.
Okay.
It's maybe the end of flu season.
Maybe.
All right. So where is Cayuga County on the big screen of flu season? I know.
So we've had almost 1,000 laboratory confirmed cases of flu.
So 1 out of every 80 people or less.
Yeah, it's insane. And we imagine that number is so much greater because a lot of provider offices were using a rapid test, and that doesn't go to a laboratory because it's done right in the office.
This is where they get it up, either
the swab
nose,
up your nose, yeah.
Another just thrilling for an adult or a child.
Or a child, yeah. So we imagine that the number of flu cases in the county was much greater and is much greater.
And is it A or B, or is it a combination of both?
I think it was pretty even the last time I checked.
And is there a difference between A and B and what the effects are, other than you feel? I was going to use a different word. Horrible.
Yeah. So what I've heard from people that have had the flu this year is that it was miserable.
I had both.
You had both A and B?
Yes. So and both of them were horrible.
Yeah. I think children were being diagnosed with B more than adults were. My own daughter had influenza B.
And she's an infant.
She was an infant. So it was a little scary because I'm like preaching, get your flu shot. We weren't taking her places. Everyone around her was vaccinated, and she still got it somehow. So that was a little scary. But I am a big proponent of people getting vaccinated.
Are you surprised at how many don't?
Yeah. I think once you get it, then once you actually get the flu, you're more apt to be getting vaccinated because it's not pleasant to deal with.
So you've got to really get it before you start making sure. I guess I'm surprised about older adults that have not gotten it.
Yeah, I don't know what their hesitation is.
Well, there's a lot of misinformation. We had, I think the last time you were on here, we were talking about vaccines, and there's a whole lot of
it's controversial for sure, and people have their own beliefs and thoughts about it. But when the flu impacts young children and older adults in particular, it's important that the caregivers of both of those populations are vaccinated.
Did we have any deaths associated with the flu at this stage?
I don't believe we had any influenza deaths in Cayuga County.
And do you think we're over the hump now?
We're still getting laboratory confirmed cases, not at the rate. It's definitely declined. It's not at the weekly rate that we were seeing in late January and February.
You mentioned vaccines. I know that occasionally I see billboards that I assume are supported by the county on whooping cough, which we don't call whooping cough anymore. Do we call it whooping?
It's used interchangeably, whooping cough or pertussis.
Okay, so why should, you have a newborn? Congratulations, by the way.
Thank you.
Why should people be, parents and caregivers, even though they may not be hanging out with the child all the time, be given those vaccinations as well?
So babies can't get immunizations right when they're born. They get a few, but then they can't get some for 2, 4, 6 months out. And
wait till you get to your 5-year well visit.
For the kindergarten shots? Yeah, I can't wait.
Yeah.
But it's important that the caregivers of those babies get vaccinated. Yeah, I know, it's pretty awful. But it's important that the caregivers get vaccinated because we can transmit the disease.
So is it a grandparent or great-grandparent?
Babysitter, your niece that babysits, your nephew, whoever, be up to date with their vaccinations. And the adult dose is called Tdap, and it covers tetanus, diphtheria, and pertussis.
And that can be, if you just go for your normal annual visit, they can take care of that for you. Do we have a lot of cases of whooping cough?
I don't know what our number is. Oftentimes we see some cases in schools, and that's because germs spread so frequently. And
I would say that it most likely is associated, if I see more advertising for it, I assume that it's a higher number. Last question, just in general, there was a story the other day in the New York Post where someone had said that this vaping, which is now to some degree replaced tobacco use, is just as addictive, and I'm not asking you to chime in on that. Do we see an increase in vaping locally?
Yes. We get calls all the time from school officials, whether it's the school nurse, the health educator, principals, about what information and resources can we share with them about the e-cigarettes and the vaping and things like that. Are
you concerned about this right now from a health perspective?
I think it is concerning because it's so new on the market that we don't know what it is, what it's about, and Cayuga County has a really high smoking rate, one of the highest in the state anyways. So for tobacco use, now we're dealing with the e-cigarettes in high school age students in particular. I think it's alarming. So it's more to come on that for sure, I imagine.
We'd love to have you back on that and other items.
Okay.
Our guest has been Cayuga County Health Educator DEANNA HOEY Ryan. I want to thank you for joining us to talk about lead, and we do encourage people to go to the county's website, which is again
cayugacounty.us/health.
And you can find out more about how to get tested for lead, how to protect your children and your families from lead poisoning. This is an issue. We would like to have you come back to give us an update from time to time, as you've done in the past. Just a quick programming note, we will be off this Thursday for April's spring break, a well-deserved break for the college students here on campus. We'll be back on Tuesday, April 10th with an Inside Government featuring Cayuga County Sheriff David Gould, who has indicated he may not seek another term as sheriff. We'll also have 2 Beyond the Front Page shows, one featuring the Auburn Chamber Orchestra and the other with the Auburn Education Foundation. They're both 15 minutes long to tell you about events that they have coming up in April and May. Before we go, though, we would like to let you know that you can send us your ideas for guests or questions to Inside Government or Beyond the Front Page. You can send your questions by email to cozguytho@aol.com or Inside Government or Beyond the Front Page, 141 Dunning Avenue, Auburn, New York, 13021. I'm Guy Cosentino for Cayuga Community College. We want to thank you for watching. We hope you have a good night, have a great tomorrow, and a happy Easter or Passover.